One. Hi guys, so today I have with me Dr. Gervelis. She is a pediatric neurologist. So thank you, doctor, for spending time with us today and answering a couple of questions.
Yeah, no problem.
Yeah. So my first question is, how did you choose that you wanted to go into the medical field? And especially, how did you come to pediatric neurology?
Yeah, I can actually credit that to my mother. She is a nurse. And so growing up, and she's also a nurse, a pediatric nurse. And she actually specialized in kids who are on ventilators and had breathing problems. So they were pretty like medically complex kiddos that she took care of. And so really looked up to her kind of growing up. And just in terms of being in medicine. And I knew that was some place that I wanted to be too.
Absolutely. And what exactly was your educational journey towards becoming a pediatric neurologist?
Yeah, so I went to my undergraduate. I went to University of Illinois and got my bachelor's degree. I actually studied, and you can major in anything as long as you hit your kind of pre-med requirements. And so I majored in a study called kinesiology, which is basically kind of exercise science. And so really enjoyed my major, got all my pre-med requisites, and then ended up going. So after my 4 years undergrad, got into medical school. I ended up going to an osteopathic medical school. There's kind of two branches. You can go to the allopathic, which is an MD, and then the osteopathic, which is a DO. And so I went to an osteopathic school for the 4 years. And then after medical school is when you do residency and or fellowship. And so my residency program was a total of 5 years after medical school.
Okay, that makes a lot of sense. Thank you for laying that out for us. So my next question is, what does a typical day look like in your particular location?
Yeah. So in my practice, I see patients from 8 in the morning until around 4 to 5 in the afternoon. I have kind of just open clinic spots throughout that time. And so the patients and their families are coming to see me for their appointment times throughout the day. And then I also have time built in my schedule where if I need to, I can go over and see children who are in the hospital. And so I see them kind of in the inpatient setting as well.
So what cases do most of the kids come to you with? Or like, what are probably the top three that you see most of the time?
Yeah. So I see mostly children who have seizures or have recurrent seizures with a diagnosis of epilepsy. And I would say that's one of the top things I see. I also see children who have headaches, different types of headache disorders and migraines. And probably the last kind of top thing that I see are children who are just having issues with their development. So they're either behind on their development, they're at an age where they should be walking and they're not, or they should be talking and they're not. And so I see them in that kind of role of figuring out what's going on with their development.
That's really cool. So since there's a variety of these things that you're seeing, what do you think is your most favorite part?
I think my most favorite part, I do enjoy epilepsy, which is good because that's probably the majority of what I see. And I also, I have kind of a special area of interest where I like seeing babies. And so I've done some kind of extra training in what we call like NICU neurology or neonatal neurology. And so I will follow kids who have been in the NICU and I'll follow them when they are also in the NICU still.
That is also very cool. So what do you think, converse to that, what do you think is probably the harder part of your job?
Yeah. So I think one of the harder things are just, we're dealing sometimes with, bad news. And sometimes even to the parent, like to me, it's not all bad. A couple of seizures here isn't bad to me, but it's really distressing to a family, to a patient, to the mom that just watched her child have a seizure. It's super scary. And so we deal a lot with just kind of the scariness of that and the kind of parental anxiety that comes with that. And so that's part of like the day to day, just having to kind of navigate worries with families. I think the other thing that is just difficult is sometimes it's hard to deliver that bad news, deliver the bad news of, okay, we found something wrong, there's something wrong with your child. And it's, sometimes things that are scary to hear, like brain tumors or, brain bleeding, or the brain just didn't form correctly. And it's not fun giving that bad news.
Absolutely. Now, what would be your one advice that you'd give the students who are going or like who are trying to get into med school or looking for a potential career in the medical field?
Yeah. I actually think actually doing what you did, Trudy, is shadowing. I think it's one thing to kind of know about it, but it's another thing to see and do. And medicine and the practice of medicine is not meant for everybody. And so really having that idea of like, yes, this is what I want to do. I'm passionate about it. I'm passionate about seeing patients and their families. Having that like deep understanding, I think, is something that is going to get you through this process, because this process isn't easy necessarily. It's a lot of school, it's a lot of work. And if you don't have that passion, you're gonna be burned out.
Thank you so much, doctor, for spending your time with us. Like, really, the information that you've given us is like truly so valuable. So thank you so much. And hope you have a really good day. And everybody else, if you like this video, please don't forget to subscribe. And thank you so much, doctor, again.
Yeah, thank you.
Thank you.